Hello everyone, my name is Arisa Vannaratha and I am from Phramongkutklao College of Medicine. Today I am honored to be present my research project on the topic comparison effectiveness of oral ivermectin, 1% permethrin shampoo and 4% Dimethicone liquid gel in the treatment of pediculosis capitis among school children in Chachoengsao Province, Thailand. Let's begin with the background that inspired this research. Pediculosis capitis or head-lice infestation is a non-life-threatening, the most unsolved problem worldwide, particularly among school-age children. The prevalence of school-age student infestation globally is approximately 19%, and in Thailand, it ranges from 15.1% to 86.1%, especially in rural areas. This condition leads to numerous health problems, including physical effects such as skin irritation and bacterial infection, and psychological and social issues like anxiety, sleep disturbance, and social stigma. Various treatments are available for hair-like infestation. In Thailand, 1% permethrin shampoo is the gold standard. However, its efficacy has significant decline due to the resistant development, particularly from its widespread use. As a result, alternative treatments such as oral ivermectin and 4% Dimethicone gel have gained popularity. Both options are effective in eradicating haze lice, preventing reinfestation, and causing fewer side effects compared to the conventional treatment. Oral ivermectin is an FDA-approved pediculosis for alternative haze lice treatment. The research showed it is significantly more effective than 1% permethrin shampoo by a unique mechanism of action. It targets glutamate-gated chloride channel, making it highly effective in eradicating lice. Similarly, the Dimethicone gel is another alternative treatment. It operates with a distinct mechanism by coating the hair with a long-chain liner silicone in a volatile base. This brings us to the objective of our research, to compare the effectiveness of oral ivermectin, 1% permethrin shampoo, and 4% Dimethicone liquid gel in treating pediculosis capitis to serve as a guideline in selecting effective and safe lice eradication medicine to patients appropriately in the future. For the methodology, we were conducting randomized control trial among school children aged 6 to 13 years in Chachoengsao Province, Thailand. Before going into the detail, let me explain the diagnosis method by wet combing. This technique involves combing the hair 20 times in each portion with a fine-tooth comb to detect wearable eggs, nymphs, and larvae, which is considered positive on haze-like infestation. For the data collection, the participants were recruited from 3 schools. Among the 862 potential participants screened for the study, 85 were eligible and enrolled. Then participants were randomly assigned to an intervention or control group. The intervention arm consisted of the Nayao group, received oral ivermectin in 2 doses of 200 micrograms per kilogram on day 0 and day 7. Naisan group received 1 application of 4% Dimethicone liquid gel for 15 minutes, then washed out with water just early on day 0. And the control group, which is Phungam Vitya School, received 2 applications of 1% permethrin shampoo. This was applied for 10 minutes, followed by rinsing with water on day 0 and day 7. Last, on day 9, participants complete the after-treatment questionnaire, which consisted of questions about the side effect of each drug. Now let's move on to the result. The comparison result is used on the day 9. For ivermectin, the current is at 95%, while only 29 and 37% of Dimethicone and Permethrin respectively. And this table shows the effectiveness of oral ivermectin and Dimethicone in treating pediculosis capitis compared to the control group, and the data was analyzed using a two-sample proportion test by per protocol analysis, and the result is significant because ivermectin showed drug effectiveness in curing pediculosis at 95% on the day after 2 drug administration. This table reports case of side effect in each treatment group during the trial. We aim to study the side effect of each medication, and there is a reported total of 4 cases and all mild side effects. Now we are moving on to the discussion part. Begin with the effectiveness of ivermectin versus permethrin. Similar to the previous study, the majority of the ivermectin group presented with no haze lice at the end of the study, while the permethrin group still have had live lice. On the other hand, comparison of dimethicone and permethrin in previous study showed dimethicone has greater effectiveness than permethrin, while our research found permethrin has a bit better. And the reason for the difference in the effectiveness of dimethicone may be that the mechanism of permethrin does not require coating the entire length of hair as dimethicone does. For side effects from earlier research, it was found that oral ivermectin in 819 participants caused side effects, including headache, dizziness, itching, nausea, vomiting, and abdominal pain. However, in our study, no severe side effects were reported. Only dizziness and nausea occur in one each case. Additionally, another study found that 1% permethrin shampoo leads to side effects, visual rash, and dry skin. In our research, itching was reported in 3 cases. For 4% dimethicone liquid gel, previous research showed side effects such as eye irritation and itching, but no side effects were found in this study. In conclusion, oral ivermectin was the most effective treatment for pediculosis capitis, showing a significant higher cure rate than permethrin. Although dimethicone gel was less effective, it remained a available alternative due to its minimal side effects. And lastly, I would like to extend my gratitude to my professor, Professor Pisha Suvarnahitathon, Professor Tundangariraj, Professor Devjit Suvarnpakdi, and the most important person in this project, our kids from Ban Nayao, Naisan, Pungam, for their invaluable participation. Thank you.
Thank you for your very interesting paper. I would like to ask about the ivermectin. What the mechanism for killing the parasite?
The mechanism of oral ivermectin is interfere is act on the glutamate gated chloride channel, then is disrupt the new nervous system of the parasite, then causing paralysis, and then makes parasite into and dead.
The 2 dose you use?
Yes.
How long for the first and second dose?
Dose 1 is on the day 0, and the second dose is on the day 7.
I think the
Can I ask some questions?
Okay.
Okay, sorry.
Dr. Suthi, please.
Yes. You have seen the evidence that it worked in the previous study. What motivates you to repeat the study again?
Sorry, could you repeat the questions again?
Yeah. The results from the previous study already show that it's work. And why you still, repeat the study again for the ivermectin?
Because the study that we researched before is not to compare the treatment about the dimethicone, oral ivermectin, and 1% permethrin. Our aim of the study is just to show you that how the different mechanism of the drug and how the oral ivermectin is very compliant and is very is easy to use because it's tablet. And for the dimethicone, it has is no problem of the resistance. So it's not the aim of the previous study is not the same as us.
Okay, thank you.
I think one of the major concern about ivermectin is about the adverse event. You collect the data related to the adverse event only 9 days after administration. Do you have any information for much more long-term side effect or complications?
Yes, it's our aim of the study too. We want to do the long-term effect with post-treatment of oral ivermectin. Yes. Because we are very concerned because not only oral ivermectin, but I think every drug in this world has a dangerous if you don't use it appropriately. Our team is very concerned. So the long-term effect about the oral ivermectin post-treatment is going to be conducted.
May I ask you one last question about your study is RCT in the same area, right? May I is there any co-intervention that happen? Like those students who take medication also do a kind of like a shampooing thing? Do you have co-intervention?
Co-intervention that I want to do.
Yeah, no. Is there any co-intervention happen among this study? Like those students in the oral medication group also do shampooing that you didn't do. Do you have any technique to control the co-intervention? Thank you.
Before we conducted the trial, we were collected the major characteristic of the participant across all three groups, and they show no significant difference across all three groups, allowing us to, effectively control the confounding factor in, which is the key of the randomized control trial. Thank you so much. ขอบคุณค่ะ